I'm Jeff Butts, and I direct a center here called the Research and Evaluation Center, which when I first got here, I thought that name sounds too generic. But now I'm very happy to have a generic name because it means we can venture into whatever areas turn up to be important. I didn't start out to be certainly an academic or even a researcher. In my early career, I was a social worker, and I worked in the juvenile court doing drug counseling with young people. And then I was a social worker for the state in Oregon, where I was living or where I went to graduate school, my first graduate school. And I was in those agencies because I thought, like many young people do, I'm going to get in there and I'm going to make changes and I'm really going to make things better. And I assumed that those agencies, juvenile court, child welfare, foster care, they existed to pursue the goals that they announced were their goals. And then I learned what everyone learns when you start your work life, that that's not always the case. That their first job was to protect themselves and their budgets and their positioning. And I did that for a couple years and thought I need to do something different. So I went to graduate school at the University of Michigan and got a PhD. And my first mistake on my path toward academia was my first meeting with the program director, where she said, "So what are your career plans? Do you want to be a professor?" And I said, "Oh no." And I didn't realize at that moment she took my CV and went, "Okay, I'll just put this over here." But since then, I've worked in a lot of university settings and also nonprofit settings. Jeremy Travis and I worked together at the Urban Institute for a few years. And I think the intersection of academics and scholarship and applied research is the most exciting place to be. And John Jay is one of the few universities, certainly in this field, where that's what we do all day long. I would contrast basic research is done for knowledge purposes to find out empirical facts about the world. Applied research, or sometimes called action research, is research done with an intent to make it useful for practice, for policy, for decision makers. And then the next step along that trail is called translational research, which is not only intended to be acted upon, intended to be used, but the researchers work with the practitioners and the policymakers to make sure that it's used correctly and actually see those changes come about. And that can be awkward for a lot of researchers because we are trained as researchers to be objective, to be dispassionate and disconnected from the consequences of our work and just to produce the facts. And we do try to do that, but in a translational context, when you're doing research, you care about the outcome and you care that the information is being used correctly and used effectively, so you stay with them. And our research center, I think we tend to specialize in that. And I've told people here, that although we do have a steady stream of academic products that comes out, we also make sure our work is done that's accessible to the public. It's written in a way that people can read, not just academics. And since I arrived, I insisted that everything we do be freely accessible on the internet and mobile compatible so you can read it on your phone. I hope we live in a post-PDF world, and I've tried to do that with our own center to make sure that things are accessible. We also tend to do projects which are action-oriented, as I said, and meant to be applied. We have several lines of work right now. Our biggest contract is for New York City government. We're working with the Mayor's Office of Criminal Justice to evaluate what they call the Mayor's Action Plan for Neighborhood Safety, which is an initiative designed to improve living conditions in public housing. And that's taken over our lives, and it's the biggest contract I've ever had. That's very exciting. We also work on violence prevention. And we have been and hope to continue evaluating the cure violence model, which is, some people call it the public health approach, which is where you hire people from communities beset by gun violence, often people that have just returned from incarceration, but people who know that life, and they might be 40 now and they're working with the 15-year-olds in the neighborhood to try to get them to see the kind of future they want them to have and not the future where they're headed. And then another project which we're just trying to get going right now is a partnership with DCJS. We have worked out all the legal hurdles and arrangements to get access to state criminal justice information to do recidivism checks. And we're calling this the Recidivism Scan Project. And we've got 4 nonprofits signed up now, so we can do, I would call it we were using the analogy of vital signs. You need regular input about your own health, and you don't always take action based upon that, but you need periodically to get those vital signs. And we think recidivism should be used for providers as vital signs. Unfortunately, in a lot of communities, recidivism data is used as an auditing function and to determine which providers are up to snuff. And that means recidivism becomes very controversial and harmful. And I personally have written things cautioning policymakers not to rely upon recidivism so much, because recidivism is not a measure of personal success among formerly incarcerated people. It's a measure of state individual dynamics, because if you live in a neighborhood with high surveillance rates and everything else, you will have a higher recidivism rate. So we're hoping to get that going, and so we can do confidential reports for private providers in New York City to check their recidivism numbers every year, like checking their vital signs to see how they're doing, without setting themselves up to be compared to another provider who may have a totally different client base. So that's the kind of work we do, and I'll end it right there. Thank you.